Good evening, everybody. My name is Adam. I am the marketing director here at AltaVita Memory Care Center. And today with us, we have Lindsay Scott, who is our marketing director for our assisted living, and Dr. Long, who is our medical director here at AltaVita Senior Residences. So today we're going to be talking about COVID and the senior population. And Dr. Long's going to be presenting that. Just kind of to kick us off, I don't know, Lindsay, do you have anything that you want to add before we get started?
Hello, everyone, and welcome. Thanks for taking the time to join us and kind of be a part of our webinar series. We're very lucky to have Dr. Long as our medical director and be able to educate us and update us, keep us informed. As far as assisted living updates, we are scheduling in-person tours. So that's kind of new as of a week or two ago. And then some other updates as far as kind of new move-in regulations and restrictions that have been lifted. So if anybody is interested in coming by and taking a tour, please reach out. Or if you just want to talk assisted living, get some information, I'm here to help.
And I think that's across the board on our campus, that all three of our buildings are independent, assisted, and memory care. We're all offering in-person tours right now. So, I mean, I know it's been a year of not being able to do those things, and now we're starting to get back to it. But to talk to us a little bit more about COVID and kind of the different changes that we're seeing now, we'll kick it over to Dr. Long and let her get started.
Okay. Hi, everybody. Sorry, I can't share my screen. I had some technical difficulties. So you won't be seeing my beautiful face. However, it was not really pretty with the filters. I don't know what was happening, but it looked like I had a beard. And so we're not going to see my face, but we'll be talking about this COVID and the seniors. And so a little bit about me. I think most of you have heard of me. I'm a geriatric psychiatrist who is interested in dementia care, senior illnesses with psychiatric illnesses. And today, Adam and Lindsay were interested into finding out a little more about COVID-19. And I know some of this information may be repetitive because, you know, we all have been dealing with it for a whole year, but hopefully you would learn something new by the end. And of course, if you have any questions, if you don't mind typing it in the chat section, and we'll go over those for sure. And you don't have to hold your questions to the end. You can just put it in the chat and we'll get to it at the end. And as I said, I am the medical director for the AltaVita Senior Residences. We offer memory care, assisted living, independent living in Longmont community. We're family owned, small company. So there are several benefits with that. So we're going to go ahead and get started. As of 3/28, there is 30.3 million cases in the US, 549,000 deaths in the US. In Colorado by itself, 460,000 cases in Colorado, 6,164 dead in Colorado. In Boulder County, 20,402 cases in Boulder County, 250 dead. Worldwide, 127 million cases and 2.78 million dead. And I know we all know that this is a global pandemic. It hasn't been easy to deal with it. And the reason that, you know, seniors are affected mainly or more than younger adults is because of several things. One is immune system, another is multiple chronic medical problems, and being more frail. And as you see, adult 18 to 39 age range account for less than 2% of COVID death compared to 81% for people older than 65. So these numbers are alarming, but hopefully we're seeing the light at the end of the tunnel with the vaccine being available, which we'll talk about in a minute too. So symptoms of COVID, and I know, again, some of this is repetitive. However, I find this interesting because, some people have no symptoms, which are the silent spreaders. Some common ones are fever, body ache, dry cough, fatigue, chills, headache, sore throat, loss of appetite, loss of smell. More severe symptoms, fever, severe cough, shortness of breath, which usually indicates pneumonia, which is usually like if people are smokers or have COPD or asthma, they're at higher risk of developing the pneumonia. Another interesting one is, as we're learning more about this disease, is neurological symptoms that are seen with COVID, which some of it still doesn't make any sense. We just don't know how this virus is affecting all the brain and neurons in our body. However, they include loss of sense, loss of smell, inability to taste, muscle weakness, tingling, numbness in the hands and feet, dizziness, confusion, delirium, which we'll talk about in a minute, seizures, and stroke. Some of the GI symptoms have been loss of appetite, nausea, vomiting, diarrhea, and abdominal pain or discomfort, which at the beginning, nobody had suspicious about GI symptoms. However, we know that over the last few months that this can be your only symptom for COVID. So it doesn't have to be always upper respiratory. It can be GI also. So older adults presenting to emergency room, there was a study that looked at 28% of them had delirium at the presentation, which what delirium means is, I know you've heard of delirious, and we all have at some point have been delirious in our lives. If you've had anesthesia, or you've had really high fever, above 102, or if you've had infections, you have had delirium. And what delirium means is if you have been, you get really sick really quick and you get confused, you can be agitated, you can hallucinate. So 16% presented with delirium as their only primary symptom. And 37% of them had no typical COVID symptoms like cough or fever. So they just showed up to the emergency room with delirium. And delirium is pretty common among older patients that present to the ER. Actually, number one cause of delirium is a urinary tract infection in older patients, especially older patients with dementia. However, I just wanted to put this out there that if an older person is suddenly confused, disoriented, psychotic, that means that they're delirious and need to have check a COVID, since it may be the only symptom that they're experiencing. And I want you to remember that coronaviruses are actually pretty common. I mean, they've been around forever. It is the cause of common cold, two dangerous diseases such as COVID-19 and also SARS, which was in 2003, and Middle Eastern respiratory infection, which was in 2016. So coronaviruses have been around forever. It's just that we're seeing more and more of this type of our body does not have immunity to it, and it can be pretty severe. And I know some people have compared COVID to a flu. However, the main difference can be that, estimated mortality rate, so death rate for COVID is 3 to 4%. However, for the flu, it's only 0.1% rate of death mortality rate. So it is not the same as flu. It's more deadly. And one reason is that, like I said at the beginning, some people can have no symptom and be silent spreaders. And another reason is that incubation period is longer. It's up to 14 days. So by the time people know that they have it, they've already spread it to so many other people. And another problem is that, like I said again, we don't realize that you're sick because you have no symptom, so you are spreading it. And it's pretty contagious. It's more contagious than the flu because of the small size of the virus. And it is caused by coronavirus, and we'll talk about this in a minute again. But it is a global issue. Global pandemics occur every 10 to 50 years, resulting from new viruses that humans haven't developed an immunity to. Many of them are transferred from animals. Climate change is increasing the risk of infectious diseases. And then one reason is that the melting permafrost is releasing viruses and bacteria that have been dormant for thousands of years, and we just don't have immunity to it. So as those become more available on Earth, we're going to get sicker, and we get sicker quicker because we don't have immunity toward them. So climate change is one of the reasons that we're having global pandemics. And of course, the effects are seen worldwide because as the travel has been easier across the world between the countries, so has the virus transmission. And this, I just want to show you that it's a history of pandemics that we've had. Started in 14th century was the plague, 1918 flu pandemic, 2003 was the SARS outbreak, which is a coronavirus, H1N1 flu pandemic, which was called swine flu, and then MERS, that Middle Eastern respiratory syndrome outbreak in 2012, which is also corona, and then dengue disease, which is 2013, Ebola 2014, Zika 2016, and now here we are in 2019 with COVID-19. And again, many reasons for this, but one of the reasons is that we, because of the climate change and being easier traveling across the world and spreading the viruses. So I'm going to jump into mental health effect of the pandemic. I mean, most of us, unfortunately, have been suffering from the same things. However, there was several studies looking at comparing 2020 to 2019, and it shows that there was elevated level of substance use, suicidal ideations that was reported in June of 2020 comparing to June of 2019. And these mental health conditions are disproportionately affecting populations, especially young adults, kids in colleges, kids in their 20s, high school kids, Hispanic persons, Black persons, essential workers, and this one is an important one, unpaid caregivers for adults. So if you're taking care of someone at home, like your spouse, mother or father, who's an elderly, there was a big spike in their mental health. And then, of course, those who already had pre-existing psychiatric conditions. The unpaid caregivers for adults, many of whom are currently providing critical aid to persons that are at increased risk of COVID-19, they in general had a higher incidence of mental health and behavioral conditions comparing to others. And one nice thing, I guess one silver lining with all of this has been that because of telehealth and telepsych availability, that Medicare and Medicaid have started covering telehealth, which I think in the future they're going to continue to cover because it has opened up doors for people that don't have the availability in their area for mental health. So it's so much easier to get telehealth, telepsych services, and Medicare and Medicaid both are covering those services right now, which started with secondary to global pandemic and COVID-19 related health, mental health consequences. But I do believe that as we go forward, we're going to be able to provide care for more people through telehealth. And oh, this is the one I was telling you about, 2020 versus 2019. Look at the numbers, how high they are. Anxiety disorder, 25% versus 8%, 2020 versus 2019. Depressive disorder, 24% versus 6%. Suicidal ideations, 10.7%, so almost 11% versus 4%. So as you can see, I mean, it is pretty alarming at how high the numbers are. But it is interesting because they said that older adults actually had less problems because they're resilient. They've had other pandemics, other global issues that they've gone through. So this was, in general, like for younger adults, the numbers were pretty high. And this is just a slide that I found that just shows you that in late June, so June 2020 is when the study was from, 40% of US adults reported mental health or substance use issues related to COVID. So usually it's 20% of US adults, but over the last year, it's been 40%. Alcohol use skyrocketed. You know, I guess they made bank because there was a 54% increase in national sales of alcohol for the week ending in March 20th, 2020, compared to 1 year before. And there was 262% increase from 2019. 1 in 10 reported that they started or increased their substance use, specifically alcohol, this study was looking at. And 3 weeks later, the WHO, the World Health Organization, came out with a statement stating that alcohol does not protect against COVID-19. So please stop drinking so much because you're going to exacerbate other health problems such as liver disease and alcoholism and suicidal thoughts secondary to intoxication, DUIs. So they were thinking that people were thinking alcohol was preventing or protecting him against COVID-19. However, I do believe it was secondary to stress levels and people coping with drinking more alcohol. So yeah, so they came up with statement saying alcohol does not protect against COVID-19 and access should be restricted during a lockdown. Please stop drinking so much. Then we're going to touch base about, some physical issues. And of course, to me, as a psychiatrist, depression and anxiety is a physical issue because it has to do with our main organ in our body, which is the brain. However, there is studies that shows social isolation causes health consequences ranging from sleeplessness to reduced immunity. There was a study that showed with social isolation, there was a higher risk of premature death by 29% increased risk. And CDC points to loneliness and isolation as serious public health risk. And even people that are supportive of safety issues and safety-related isolation and quarantine, they can experience frustration and irritability. So it can be hard all around for everyone. Then isolation and loneliness are linked to poor cardiovascular health, so heart disease, cognitive issues with dementia. I find this interesting. They were saying that the social deficiencies are associated with a high risk of coronary heart disease by 29% increased risk and 32% for stroke, 40% increase for risk of dementia. And then we talked about early premature death of 29%. These numbers are quite alarming, but I do inpatient psychiatry, and I've seen all of these, unfortunately, and increased risk of suicide. And one of the reasons, with the social isolation is that people start to be less active, obviously. The regular walk and talk in the park, meeting acquaintances or meeting for coffee, voluntary services, church gatherings, all of these things, or contact with plants or animals, all of these things have decreased and causes to have consequences with your health. Self-care strategies, again, some of this is repetitive. I tried to find a way of making it more interesting, but it is what we've been hearing for a whole year, which is engaging in relaxing activities, exercise, stretching, reading, listening to music, meditation, prayer, journaling, finding a new hobby can all help relieve stress. Following a routine is very important. Daily routine of getting up at the same time, eating at the same time, rather than staying up late, getting up late, not eating well. So maintaining healthy habits, eating well, getting enough sleep, engaging in physical activities, staying connected, even though it's not in person, but having phone calls, emails, texting, social media platforms, video conferencing can all be used to stay in touch. I know it's not the same, however, it gives you that sense of connectivity that you are connected with the outside world. And staying informed is important. However, too much exposure to negative news can feed anxiety. So learning the facts is important to avoid feeling panicky. However, if that's all you're watching, you're just watching the news 24/7, and news people get hyped up because that's how they make money, that's how they sell ads. which can cause increased anxiety in all of us. Some of the therapeutic treatments, therapists can be helpful to explore kind of some of the underlying issues related to isolation, such as depression or anxiety, because those are all rampant in this day and age with pandemic. And some of the types of therapy that can be helpful, one of them is cognitive behavior therapy, which is talk therapy that helps people kind of become more aware of their negative thoughts or inaccurate thoughts, and helps you kind of identify misperception and reshaping your negative thinking. Another type is, if you don't want to do too much work, would be supportive psychotherapy, which is kind of like talk therapy. However, your therapist would be able to point you to the right direction of maybe you can think of some positive things in your life rather than all negativity. And please seek professional help. If you're feeling, you or your loved one, you think like they're having more increased confusion, delusional thinking, hallucinations. I had a patient who actually during this whole pandemic, she got very isolated. Her world got very small. She already didn't have a lot of family in the area. However, her world was surrounded with her church. And when everything shut down, she became, just isolated to her apartment. She started hearing voices, thinking that there was somebody in her attic. And then because she was afraid of those people, she stopped going outside of her room, outside of her apartment. Thank God she had really nice, caring neighbors who were able to call the police for a welfare check. And by the time she got to the hospital, she was quite psychotic. And really, it all started with just becoming very depressed and what we call depression with psychosis. So if your depression is not treated, it can turn into depression with psychosis with psychotic features. Excessive feeling of anger or fear, extreme swings of an emotion. People can be hot, can be cold, they can fly off the handle really easily. Inability to cope with daily problems, major changes in eating or sleeping. People can sleep too much or they can sleep a little. They're up all night, they're watching the news, or they can eat too much or not enough. People, I have another lady that I just got admitted to me 2 days ago. Since the pandemic, her children don't live here, so they didn't really know what was happening. They would call her every day or every other day, and she was superficial with them on the phone. However, coming to find out that she has lost 30 pounds over the last year. And now, of course, she ended up with me in the hospital with severe depression, which has caused her to lose about 30 pounds. So all of these things, the reason I'm telling you about it is because the sooner you treat, the better outcome you have, and it's easier to treat at the beginning. Numerous unexplained physical ailments. Another example I have, I've had a woman who has had 11 ER visits over the last month because of different physical complaints. And every time she goes to the ER, they're like, there's nothing wrong with you, and they send her home. And then 3 days later, she calls 911. She ends up back in the ER. So finally, somebody was like, oh, maybe she's depressed and anxious. And she was admitted to the psych unit, and she definitely is depressed and anxious with somatic complaints, because physically she's pretty healthy otherwise. again, prolonged depression, which, like I said, if the depression is kind of caught at the beginning, it's easier to treat. However, as it's prolonged and it becomes more difficult to treat. Social withdrawal, and of course, that's a really hard one because how are you going to be socially active? But I think what this means is that you stop talking to people on the phone, or like waving at your neighbors, or stop doing your hobbies, stop reading books, listening to music. And substance abuse is a big one, with alcohol, opioid use. With the pandemic, people turn into those type of coping skills. Technology help. So, one of the things is that younger people are quite diverse with using technology to their benefit. However, I can tell you, I have 2 kids in their 20s, and even though seems like they're always on their phone or they're always on social media, they're very disconnected from their friends or family. It becomes like, it feels like that they're connected, but as I mentioned before, there's like a perceived sense of belonging. However, they're not really as connected. But with older patients, older adults, the problem is that sometimes they're not as familiar with using technology. Like my own mother, I've had to teach her so many times with FaceTime, and she still sometimes just cannot figure it out. And we just talk on the phone. But it's very hard for her to navigate the internet, email. So it can be a hindrance, but I think a lot of older patients have become pretty savvy, tech savvy, and there's been some good that came out of this pandemic. And this one I found quite interesting because, I've had so many people that even with televisits, sometimes I end up just talking to the person on the phone because they can't figure out how to do video. Kind of like how I couldn't figure out how to do the video without my face being disturbed. But so if there are 2 free services, one is the National Senior Planet Hotline, which supports older adults who need assistance with using technology. And the other one is seniorplanet.org, which can show you, which I like this Stuck at Home guide. It provides you helpful tips with getting connected online, using Zoom. And they're both free, which is really nice. They teach you like how to do online banking, accessing your telemedicine, internet, grocery shopping. So those are kind of 2 nice free tech support. And in Colorado and Boulder County, there's several agencies that have been very busy over the last year. The main one that I usually start with, if there are any patients that need to be referred to, would be Boulder County Area Agency on Aging. They're always very helpful into finding more information of what you need. However, I went ahead and sorted out, and this information you can get from Adam if you're interested. He can just email you the slide with Colorado Division of Aging and Adult Services, Boulder County Adult Protective Services. So I've done this before where, we had to discharge a patient home, but the patient lives by themselves. There's no other family or support system. in place. So I've called Adult Protective Services before to go and check up on this person and make sure that they're safe at home, that they have what they need to survive, and they have what they need to be safe at home, basically. And another thing that we call APS for is if we're suspicious of anybody being abused financially, physically, sexually, any adult person. Then Colorado Department of Human Services. This one is if you are running out of resources, money, they can help you navigate and apply for Medicaid, State Health Insurance Assistant Program, or SHIP, which is, again, if you're running out of resources, they'll be able to tell you what's the best approach, if you can apply for Medicaid, or if they can help you apply for a secondary insurance. Colorado Legal Services of Boulder County, they can be helpful with free legal advice. And then if you need extra help, they can refer you to other services. Long-term care ombudsman. These people are usually your lifeline for long-term care facilities. Each facility has their own person, and therefore patients and patients' family members. And they're always very helpful and very super sweet and knowledgeable people. And then there are several phone support lines. The first one is AARP Friendly Voice. That's literally what it's called. And it is, their ad actually says just hearing a friendly voice on the other end of the line can help with challenging times. It's 24/7. Then AARP's Family Caregiving Resource Line. Then there's a SAGE National LGBT Elder Hotline. There's a NAMI helpline. NAMI is National Association of Mental Illness. They have a lot of resources. They have a lot of support group. And most of these are online on Zoom these days. So if you are yourself suffering or taking care of someone who's suffering from mental illness, NAMI support groups are awesome. And then last but not least, National Suicide Prevention Lifeline, also 24/7, free and confidential support for people in distress. And, having been in this type of business with geriatric care, I found that I was always interested when I was working in Front Range and going to different facilities. I was always interested in the fact that, some facilities I love, some facilities I really didn't care for, some facilities I stopped going to because I just couldn't do it the way they were operating. But when we came up with AltaVita, it was just kind of out of love for seniors and love for wanting to have a place that can nourish elderly and be able to call home. And some of the benefits of people that have been in senior living over the last year has been that there's always somebody there. Staff are trained professionally to assist residents with their daily living, such as dressing, bathing, medication assistant. The accessibility to manage their health and daily activities with their doctor appointments. Like at AltaVita, we have physicians that actually come to the facility. We have ability to do telepsych appointments. So there are different things that have been some benefit from people being in senior living situation. And we've always had activities, of course, sometimes when we were on the lockdown and at the beginning, when we had to do like a 14-day quarantine, it was more difficult. However, we've always been able to do activities with social distancing and masks and all that other jazz that we've been doing. And of course, now that most of our residents and staff are vaccinated, hopefully we're going to get back to some normalcy. And research actually suggests that higher level of social support and lower level of loneliness are directly related to improved well-being. Of course, I think that's kind of a duh statement, but they have done studies that show people who are in facilities usually have better ability to stay more cognizant and less dementia. And then I want to end with please begging people, everyone, to, if you get a chance to get the vaccine, please do it, because this is one way that we're going to hopefully come out of this pandemic, is if we all get vaccinated. And like I said, at AltaVita, most of the residents are vaccinated, most of the staff members are vaccinated. And we have 3 different ones in the US. And the reason I just wanted to kind of put it out there is to compare them, the 3 together, and to tell you that it is safe. The first 2, Pfizer and Moderna, they're both what we call mRNA vaccines, which is messenger RNA, which teaches your immune system to develop antibodies. So when you are exposed to COVID-19, your body already knows what to do. Pfizer is 16 and up. There's 2 shots, 21 days apart, 95% effective. On rare occasion, this is the only rare severe reaction, 11 cases and 18 million vaccination. So, and even if it does happen, if you have an anaphylactic reaction, it is treatable with an EpiPen. That's why they ask you to wait for 15 minutes after you get the shot. So just in case if there's any severe allergies, and an EpiPen can be used. But again, I want you to pay attention to the 11 cases and 18 million vaccination. So I think if this does happen to someone, that they need to go out and buy a lottery ticket, because it's so rare. Hopefully nobody will experience it. However, even if you do, EpiPen will help with the anaphylactic shock. Moderna is another mRNA vaccine that works the same way as Pfizer one does. 2 shots, 28 days apart. It's 18 and older, 94% effective at preventing symptomatic infection. Again, on rare occasions, you can have an anaphylactic reaction, but EpiPen works for this also. And then Johnson & Johnson is the latest one. This one is a little different. It's a carrier vaccine, so it's just a different approach. But this type of vaccines have been around forever. In this one, it instructs your cells to make SARS-2 spike protein, which triggers an immune response. And this is why, like you may get sick after 12 to 18 hours, because your body is actually responding to seeing these spikes in your body and says, oh, this is not normal. I need to create some antibodies. And there's an immune response, which causes you to have a fever. And this one, 72% overall efficacy. However, it's 86% efficacy against severe disease. So what that means is that even if you do get, you do contract COVID, it's 86% effective that you're not going to get severely ill and end up in ICU. So any of these vaccines are effective. Of course, like I said, the Pfizer one is 95%, Moderna 94%, J&J 72%, but all of them are pretty effective. So please,
Dr. Long,
yes.
this is just a question that's come up recently for me here, that somebody did ask me, can the vaccine, for those individuals who do suffer from dementia, can the vaccine actually increase confusion for those individuals?
No, we haven't seen any. And I don't even see why that would be, because you're not, any of these vaccines, you're not introducing COVID virus in your body. So it's just like with the mRNA, it's the messenger RNA. And with the other one, it's the spike proteins. So, and no, there has not been any increased confusion that I know of. It's mainly your body reacting to the antibody, which is usually fatigue, fever, maybe nausea, shivering, but all of those things are very temporary and they go away within a few hours. Are there any questions in the chat room or?
I don't see any questions as of right now.
Okay.
If anybody has any questions, you can always send them through the chat or the Q&A, and I can read those off to Dr. Long for you.
Yeah, because that is kind of my last slide. Because like I said, it was kind of repetitive because we've been dealing with this for so long. But what I found interesting when I was doing this type of looking through, this just blew my mind, 2020 versus 2019 of the percentages, 25 versus 8 for anxiety, 24 versus 6 for depression, and 11 versus 4 for suicide. And of course, 1 out of 10 in substance use.
Does look like there's a question. Have you had any experience using ivermectin to treat COVID?
No, I
hope I say that wrong, right?
Let me see what can I see the chat? Let me see.
It was in the Q&A.
Oh, Q&A.
I think one of the most interesting things too that you touched on is kind of all of the things that have come up for seniors with COVID, this pandemic, is the isolation piece. And we see a lot of seniors isolating at home in general, outside of COVID due to, different things like dementia and mobility and other kind of health concerns, and how that isolation piece can actually exacerbate some of those conditions that they're dealing with, and how having home health come in for, physical therapy, occupational therapy, or home care coming in, or even just moving into a senior living community, can actually increase that socialization and help improve quality of life and decrease some of those symptoms that they're experiencing.
Right. Yeah, that's why I kind of put in that slide, because I mean, we already know that people were isolated before for many different reasons, for not driving, like for my own mother, my dad has dementia, so she's like stopped going out because it was so hard to get him out. So that it was already starting. So and then of course, when the pandemic hit, everything got worse and everybody's worlds got smaller. So yeah, it's been, I think some of the people that lived in the senior living already had a little better chance of living through it. I know it was hard because you couldn't see your family members. However, you were able to kind of Zoom, and then when you were Zooming, staff was helping them make those calls. So I was just looking at that ivermectin, because I've never used it. And it does say do not use for COVID-19. It says it's unsafe for COVID-19. This is at one of the sites I use. It's called UpToDate. So this is pretty accurate. And it does say do not use it. It's antifungal. FDA does not recommend using this for COVID. Okay.
And I don't see any other questions that have come through. So thank you, Dr. Long. I mean, this was, even though a lot of this information has already been kind of put out and we've learned a lot of it, I think that there were some things in here that really kind of stood out to me personally, just kind of being in this industry and knowing what we're looking at has helped a lot.
Right. And I would say one more time, I just want to emphasize to please get vaccinated when it's your turn, because, and I know people have had several concerns of saying, oh, this was developed so fast, blah, blah. But we have had, and this is why I put up this slide, we've had coronavirus forever. It's nothing new. It's been around, 2003 was SARS, 2012 was MERS. So we have had coronavirus, cold viruses, and the vaccinations were in the mix. They're being, so it's just one of those things that please don't be afraid. And again, 11 cases out of 18 million doses of vaccines given had severe reaction. So don't be afraid of saying, I've heard people say, oh, but I had a reaction to the flu vaccine. Well, what kind of reaction did you have? I mean, everybody can have reactions to different things, but flu vaccine and COVID vaccine are not the same. So
I think the worst reaction I had to the vaccine was my arm hurt for like 3 days.
Oh, right. Yeah, I mean, I was very fortunate. I didn't have any reaction at all for either one. I got the Pfizer. My husband had J&J, and he was kind of sick for probably 10, 12 hours with a fever and just not feeling well, just fatigue in general. But that was it. One of my cousins got really sick with the second dose of Pfizer with chills and fever for 12, 13 hours, but that was it. But getting COVID, it's a lot worse. I can assure you that.
I think I would much rather have my arm be sore than being on a ventilator. That's
Exactly. Exactly.
Lindsay, do you have anything else to add?
No, this is all great information, even though, like you both said, we've kind of been hearing a lot of this off and on since last year. There were some great points I think you made, Dr. Long, within the content. So thank you very much for doing
Yeah,
the
of course.
presentation for us.
Yeah, of course.
And thank you everyone for joining, and
And like I
hope
said,
you
if you guys,
came out of it.
yeah, and if you guys want that slide about resources, you can ask Lindsay or Scott, Adam, and they can email them to you. Thanks again for everyone taking time to attend, and I look forward to doing more of these.
Yeah, Dr. Long actually has another webinar coming up in April through the Aging at Altitude Expo. And so we're really looking forward to that. So that information will be coming out soon. And again, if you guys want more information about AltaVita or touring the community, don't hesitate to reach out to Lindsay or myself, because we would be more than happy to set you up with in-person tours finally, which is amazing news for us. So like I said, if you have any questions, feel free to reach out to us. And thank you, Dr. Long, and thank you, Lindsay.
Yeah, and I do believe that hopefully there'll be in-person visitations pretty soon too. You know, we just kind of have to do it step at a time, and we have to follow what Boulder County Health Department tells us, but we're hoping that we'll have in person. Of course, you know, everybody still has to wear a mask and stuff, but it would be really nice to be able to, like I haven't seen my own dad for almost a year, so it'd be cool to be able to hug him again. So
We actually, Dr. Long, just started in-person scheduled apartment visits this week in both memory care and assisted living.
right. So there's going to be, hopefully,
Yeah.
people get vaccinated and we can see some normal activity.
Normalcy again, yeah.
Yeah. One step at a time.
Yeah. All right. Thank you, guys.
Thank you,
Thank
Dr.
you.
Long.
Mhm.
Um,
Bye-bye.
Bye.